Welcome to the Stroger Hospital's training module number 9, Cleaning Process for ICU Patient Rooms and Patient Restrooms after the patient has been discharged. We're glad you're here.
At Stroger Hospital, we believe that thorough environmental cleaning and disinfection is crucial to the health and well-being of patients, guests, and staff. As such, it is vital to understand the importance of environmental cleaning and disinfection of patient rooms. Our goal is to remove the contamination of microorganisms from surfaces and equipment where patients receive care, in order to minimize the risk of disease transmission and cross-contamination. In this training module, you will find that many of the cleaning processes and techniques that you learned in training module number 8, Cleaning the Occupied ICU Patient Room, are the same or very similar to what you will be learning here in this module. The essential differences will be in the additional cleaning tasks we add in because we are cleaning an ICU room where one patient has been discharged, and we are preparing to receive occupancy for a new patient. Simply stated, we have more work to do in a discharge room cleaning than in an occupied room cleaning. A summary of what we will be covering in this training module includes: Number 1. Coordination of your work with the medical team is important. Number 2. Pre-inspection of the room for planning your work. Number 3. Safely emptying waste containers and removing trash. Number 4. Safely removing linens, such as sheets and towels, followed by training on how to thoroughly disinfect the bed mattress, side frame rails, headboard, and footboard. Number 5. High and low dusting of patient room, emphasizing more thoroughness in this task simply because we can more easily do this work when a patient is not present without the risk of stirring up dust in the patient's indoor air environment. Number 6. Disinfecting surfaces, especially what we call high hand touch surfaces. Number 7. Spot cleaning surfaces. Number 8. Cleaning and disinfecting the patient restroom. Number 9. Dust mopping the floor. Number 10. Performing final inspection of the ICU patient room. Number 11. Damp mopping the floor. Number 12. Double checking everything as a final step before exiting the ICU room.
Before any cleaning work begins, make a determination of the correct PPE you must wear prior to entering the patient room. You will make this determination by reviewing the PPE precaution sign posted outside of the patient room. There are 3 types of precaution signs: droplet precautions, airborne precautions, and contact precautions. Each type of precaution specifies the type of personal protective equipment you must wear. Follow the PPE requirements and instructions exactly and completely. If no precaution sign is displayed, then assume that you must wear the standard PPE of a Stroger uniform and vinyl gloves for your hands. Start by thoroughly washing your hands in the manner specified in the Stroger Training Module number 3, titled Hand Washing and Hand Hygiene. After completing hand washing, put on new clean gloves and any additional PPE as specified by the PPE precaution sign outside of the ICU patient room.
Properly positioning your cart. Remember to position your cart properly next to the ICU patient room door, opening, but do not block the doorway with your cart. Next, knock on the patient's room door and do so even if the door is already wide open. This is a polite way of announcing that you are coming in and also asking for permission to enter. Since this is supposed to be a discharge ICU room, there should not be a patient inside. Sometimes, a mistake in scheduling can be made, however, so don't just assume the room is empty. Wait to hear a response before entering. If you do not hear a response, knock again. If you still do not hear a response after the 3rd knock, enter slowly, being careful to listen and look for the presence of a patient or some other person in the room. If no one is in the room, you may begin your work and assume that it is truly an empty ICU room that the patient has been discharged from. If there is other medical staff working in the room, say hello and introduce yourself with a smile. Coordinate and plan your work around the work being done by the medical staff to allow for smooth teamwork in efficiently preparing the ICU room for the next patient.
When placing the wet floor sign at the entrance to the ICU room, be careful not to block or only minimally block the entrance to the room with the sign. The sign needs to be visible but should not be right in the center of the pathway of the walking lane into the room.
Your next step should be to inspect the area before pulling out trash from the waste containers. This is to determine the portions of the ICU room that need special attention and to allow you to plan your work efficiently. This step also lets you gather loose trash and place it in the wastebasket before pulling the trash from the cans. As you should know from your Stroger Hospital safety training, it is important that you keep biohazardous waste located in the red trash cans with red liners separate from regular waste. Never mix the two together. Last thing, when you inspect the ICU room, or as you are performing your work, you may find personal items that were left behind from the previous patient. If you do, gather these items and turn them into your supervisor so that they can be returned to the patient.
If there is a large amount of waste in a receptacle, do not use your hands or feet to compress the trash. Never compress trash with hands, feet, or any other part of your body. This is to prevent injury from loose sharps that might have been improperly disposed of. When pulling trash, gather trash liners at the edges and tie the liner closed. Lift the waste liner slowly out of the receptacle, keeping it away from your body. Never let the trash liner, filled with the trash, bump up against your legs or any part of your body. Carry the trash to the designated container. Before replacing the trash liner with a new clean liner, wipe the interior and exterior of the waste receptacle to disinfect and to remove any spills, drips, smudges, or fingerprints.
Removal of soiled linens. Like pulling trash, the removal of soiled linens must be performed with good attention to safety so that you avoid accidental cuts or pokes from sharps that may have been improperly left in the folds of the bedsheet, towels, or other linen. For the removal of bed sheets, start at the far corners of the bed and pull the corners of the sheets into the middle of the bed. Do this for each of the four corners. When you pull the corners to the middle, grab by pinching the farthest edge of each corner with your fingertips. Do not grab sheets or other linens with a closed fist, compressing a bunch of material into the palm of your hand. Also, once you pull the corner of the middle of the bed, let the corner drop out of your fingertips into the middle. Do not push the sheets down onto the bed with your hand. If necessary, you can repeat this process, folding the farthest corners into the middle. Use your fingertips. Let the sheet corner drop to the middle, but do not compress. When you have finished folding the corners in, you will have a small bundle of sheets. Again, using fingertips only, pick the bundle up by your fingertips, minimizing the amount of linen material that you have to touch with your hands. Once you pick up bundles of sheets, do not shake the bundle. Always carry it gently. You should use a similar process for gathering towels, specifically being safe and carefully watching out for needles or other sharps that may be hidden in the folds of a towel. Always handle the towels and other smaller linens by your fingertips. Fold into the middle and do not shake out towels.
Place soiled linens in the blue bag soiled laundry container. Let the soiled linens drop in and fall into the bag under their own weight. Never compress the linens into the bag by pressing them down with your hands or any other part of your body.
High and low dusting. Always start dusting by first doing high-level dusting, then work your way down. Because this is an unoccupied discharge ICU patient room, now is the time for you to perform a more thorough dusting, especially around the areas that needed to be avoided when the room was occupied with the patient and guests. Two of these critical areas are the ceiling and wall vents. Remember that most ICU patient rooms have a wall vent above the patient bed, a ceiling vent located in the ceiling, and a door vent located in the lower portion of the main patient room door. When high dusting, take the microfiber duster and the extension tool and dust shoulder height or higher in the area. Dust the walls, ceilings, vents, ledges, furniture, fixture vents, and the wall area around vents. Dust window sills, baseboards, and chair rails. Generally, you need to look for dust accumulation on any horizontal surface that can catch dust and make sure that you thoroughly clean it off.
Sanitize all horizontal surfaces, and with an emphasis on what we call high hand touch areas. High hand touch areas are surfaces that get a lot of hand traffic. If you look around the ICU room, you can see what the high hand touch surfaces are. Examples include doorknobs, light switches, bed rails, chair rails, patient food tray tables, telephones, TV remotes, nurse call buttons, cabinet pull or push knobs, and counters. Sanitation or disinfection cleaning is accomplished by applying neutral disinfectant cleaner to the surface. But remember, you must allow for the necessary 10-minute wet dwell time for the disinfectant to kill germs. Follow this process. Apply the neutral disinfectant cleaner, allow it to sit 10 minutes of wet dwell time. Wipe it clean using the appropriate wiper. Use a blue wiper when cleaning in the patient room. Use an orange wiper when cleaning in the patient restroom. Leave the surface in a clean and streak-free condition.
Cleaning the patient bed. As an important step in cleaning and sanitizing all horizontal surfaces, special attention must be made in thoroughly cleaning and disinfecting the patient bed. You should have already stripped the bed of all sheets and linens. If you have not, perform this task before any bed cleaning starts. Now, with sheets removed, all surfaces of the bed must be cleaned and disinfected. Utilizing the neutral disinfectant cleaner, start by cleaning the headboard and footboard of the bed. Clean the side rails, then move to cleaning the mattress pad. Clean both sides of the mattress pad as well as the side surfaces of the pad. Move the pad to one side and clean the hard surface platform that the pad rests on. Move the pad to the other side and repeat this process of cleaning the hard surface below the pad. Now, use the electric controller to raise the bed up into an upright position. Begin cleaning the underside of the bed that is exposed by raising the bed up. Thoroughly clean surfaces in all cracks and crevices. Moving downward, clean the lower surfaces of the bed, including the lower sides of the pedestal stand and the back and front all the way down to the level of the floor. In all cleaning of the bed, allow the required 10-minute wet dwell time for the neutral disinfectant cleaner to eradicate all microorganisms. Once all surfaces have been cleaned, return the bed to the lower, fully flat position. As your last step, clean the push button controller that you have been using to raise and lower the bed.
Vertical surfaces are areas such as walls, doors, door frames, and cabinets. Again, look for places on vertical surfaces where dirt, germs, splashes, or smudges can accumulate and focus cleaning attention on these places. Examples include walls near or around the waste can often can get splashes or spills. Door push plates or door frames are frequently touched by hands and can have smudges and fingerprints that need cleaning. Cabinet doors can also have fingerprints, smudges, and accumulate dirt. Spot clean vertical surfaces, such as these, using the neutral disinfectant cleaner and the appropriate wet dwell time to let the disinfectant kill microorganisms.
Cleaning the patient restroom. Prepare to clean the restroom by placing the wet floor sign next to the restroom door. Next, high dust all horizontal surfaces in the restroom. For disinfection cleaning of surfaces and fixtures in the restroom, make sure you are using neutral disinfectant cleaner and orange microfiber wipers. Remember, orange for bathroom cleaning only, blue for room cleaning only. Remember, on all bathroom surfaces, it is very important to apply the neutral disinfectant cleaner and allow for the full 10-minute wet dwell time for the disinfection to fully kill germs, viruses, and other microorganisms. Make sure to clean mirrors and dry with a paper towel to prevent streaks. Clean the sink and the surrounding area, such as the counter, underside of the bowl, and the piping under the sink. Make sure to spot clean all splash marks on the wall that may be adjacent to the sink, the toilet, and the shower. Clean the shower, starting at the top and working your way down, and being sure to scour the shower basin floor. Next, start disinfecting the toilet by first applying bowl cleaner into the bowl of the toilet and allowing it to sit 10 minutes or more. Apply neutral disinfectant cleaner to the rim of the toilet, to both sides of the seat, and to all exterior surfaces of the toilet, again allowing for proper wet dwell time. Wipe all surfaces of the toilet down and leave in a clean and streak-free condition. When cleaning the inside of the toilet bowl, use a Johnny Mop to clean the inside and then replace the Johnny Mop in its carrier container. Note: do not use toilet bowl brush or Johnny Mop on the outside of the toilet bowl or any other surface other than the inside of the toilet bowl. Remember to empty the bathroom waste can, taking all the same precautions used in emptying the patient room waste can. For example, do not compress the waste, and do not let the full waste bag you have pulled from the can bump up against any part of your body. Wipe the waste can clean and reline with a new, clean liner.
Next, we're going to talk about refilling dispensers for soap, hand towels, and toilet paper, and damp mopping the restroom floor. But first, stop. Remember, you have just cleaned the restroom. Your gloved hands are contaminated with microorganisms of the bathroom. Before you proceed to refill the dispensers and restock towels and linens, you must dispose of your gloves, wash your hands, and put on new clean gloves. Restock the paper towels with the fold properly facing downward so that the towels dispense as they are intended to. Refill the toilet paper dispenser. Make sure spare rolls are stocked in the room. Refill hand soap dispensers. Refill shower toiletries. Replenish bath towels, hand towels, washcloths, and other linens. As your final step in cleaning the restroom, damp mop the floor.
Dust mopping the floor. Always make sure you dust mop before damp mopping the patient room floor. This excludes instances of obvious blood spills in the room, in which case it is appropriate to clean using the Stroger Hospital Protocol for blood-borne pathogen cleaning as described in the Standard Operating Procedure and Training Module number 24. When dust mopping, make sure you work clockwise around the room using an S stroke while keeping the leading edge moving forward. Be sure to move any furniture and dust mop underneath. Make sure you dust mop carefully in corners, along edges, and on the baseboards. Be careful not to lift or shake the dust mop during or after use, as this will cause excess dust to be lifted airborne into the indoor air environment.
Before damp mopping, take a moment to do a final inspection of your work and make sure you have not missed anything. This is the time to inspect curtains and look for stains or portions of the curtain that might need repair. Be sure to check the sharps container and arrange for its replacement if it is filled to capacity. Remember, sharps containers are sealed for your safety and the safety of everyone at Stroger Hospital. Never attempt to open a sharps container. Double check all soap and hand sanitizer dispensers to make sure they are properly refilled. The same final check should be made to all paper products dispensers and all towels and linens. It is important that you check door hardware and metal kick plates to make sure they have been properly cleaned. If any items in the room need repair or any lights are burnt out, be sure to report this to your supervisor so a work order can be submitted to the Stroger Buildings and Grounds Department.
Damp mopping. Prepare to damp mop the floor by placing a second wet floor sign inside the ICU room. You should have one wet floor sign outside of the room at the entrance and one in the room, with both being highly visible to minimize the risk of slips and falls. Begin damp mopping the floor, working around the room using an S stroke and paying a special attention to corners and baseboards. Make sure to move any furniture and mop underneath. Make sure you mop behind the doors. If you find any spills or stains on the floors, on the baseboards, or in the corners or edges that you cannot remove, report these to your supervisor. Before reporting this, however, make sure you have made every effort to remove the spot, stain, or spill yourself.
Take one final look around the ICU room and the rest of the room to make sure that you haven't left any of your tools or supplies behind. Also, double check your work to make sure you haven't missed anything. If there are any repairs and maintenance tasks that need to be performed, note these and report this to your supervisor so that a work order can be submitted to the Buildings and Grounds Department of Stroger Hospital.
Thank you for participating in Stroger Hospital's training module number 9, Cleaning the Discharge ICU Patient Room and Patient Restroom. We hope that you have found this training useful and informative. As always, if you have any questions concerning your work at Stroger Hospital, please inquire with your supervisor.